Good afternoon, everyone. My name is John Garcia. I'm the project director with the Home and Community-Based Waiver team here at Mass Health. I want to thank everyone for taking the time this afternoon to join us in this presentation of the Money Follows the Person demonstration. I'll have with me today is Jennifer Reed and Eileen Gametto. I'll have them introduce themselves as well.
Hi, I'm Jennifer Reed, the Assistant Project Director on the Money Follows the Person grant, and I work for John. Eileen?
Hi, my name's Eileen Gametto, and I am the MFP Demonstration Operations and Eligibility Manager. Tim, I'll turn it over to you.
Thank you, Eileen. Good afternoon, everyone. My name is Tim Cahill, and I'm Assistant Commissioner for Operations at DDS. And I'll be covering some of the slides later in the presentation that talk about what our staff's role is for this new initiative. So I will turn it back to the MFP demo team. Thank you.
Thanks, Tim. Do we have the slides, Dana? Great. Thank you. So again, welcome to the Money Follows the Person demonstration overview for the DDS service coordinators here at DDS. Today is February 6th, 2024. Next, please. So in today's presentation, we're going to go over a few things. We'll have an overview of the MFP demonstration. We're going to talk about the qualification criteria for the MFP demonstration. We'll talk about the services that are included within the MFP demonstration, as well as the responsibilities of the service coordinators that are assisting individuals on this program. And also we'll provide you with some referral processes later towards the end of the slide deck. Next. So what is the Money Follows the Person demonstration? The Money Follows the Person demonstration, or MFP demo for short, is a federal funded grant that covers services to help people with disabilities and older adults move from qualified nursing facilities and long-term stay hospitals to qualified residences in the community of their choice. Mass Health previously operated the MFP demonstration back in 2011 through 2018. And at that point, we transitioned over 2,100 individuals from facilities across the state to different types of home and community-based settings. Just in the last year or so, as of April 27th, 2023, Mass Health re-engaged with CMS, and we also, which is the Centers for Medicare and Medicaid Services, to move forward with the implementation of our MFP demonstration. Next. So how does the MFP demonstration work? Using our existing waiver outreach and enrollment mechanisms, we want to try to identify and enroll individuals in the MFP demo. We think we can serve individuals in the MFP demo and offer them services that they would otherwise be inaccessible. Some of the things, if you're waiver eligible, could be getting certain housing assistance and food security services. For non-waiver eligible, there's transitional assistance like home mods and so forth. What we want to be able to do is also take advantage of enrolling our waiver eligible individuals to help take advantage of the additional MFP demo federal funding. In many cases, the individual is enrolled in both a waiver and the MFP demo. And later on in the slide, we'll talk about the different types of waivers as well. Next, please. So this slide represents target populations that are set forth by CMS. And in our negotiations with CMS, these are the different types of target populations that are identified for the MFP demonstration. There are elders, individuals with intellectual and developmental disabilities, individuals with physical disabilities, as well as individuals with mental illness. And again, I just want to reiterate, these target populations are set forth by CMS and not Massachusetts. Next, please. During our course of our MFP demonstration, there are certain benchmarks that we have to adhere to and get approval from CMS. So in calendar year 24, the current year, we're hoping to enroll and transition 600 individuals for the demonstration, as well as for calendar year 25 and 26. So we're technically trying to enroll a little over 1,800 individuals over the next 3 years on the demonstration. We also, one of our benchmarks is to maximize the use of at least one self-directed service, such as, the state plan PCA program and other home and community-based services. We also want to be able to utilize housing vouchers that we have received through the alternative housing voucher program to help folks provide assistance in finding rentals, as well as helping them pay for rent as well. Next, please. As I mentioned in the earlier slide, these are the projected transitions that we have agreed to with CMS. And obviously in 2023, we indicated 600, but because we got a late start in working with CMS, we did not meet the goal of transitioning 600 individuals. But our goal for this calendar year and forward is to at least transition 600 individuals by each calendar year, and to also look at the different types of target populations as well. And you'll see that here in the table. Next, please. Qualify for the MFP demonstration. An individual must be living in a qualified nursing facility or a long-stay hospital for at least 60 consecutive days, including Medicare rehabilitation days. The individual must be 18 years or older and be disabled, as defined by the Social Security Act and Mass Health Regulation, or be age 65 and older. To be eligible for the demo, they also have to be meet the eligibility for Mass Health Standard or Common Health in the community, and their last day in the facility has to be paid by Medicaid or Mass Health. They also have to be a Mass Health resident, as well as a Massachusetts resident. They have to have signed an informed consent form and transition to an MFP demo qualified residence in the community of their choice. Next, please. The way we count days for the MFP demonstration to be qualified is that, again, an individual must be living in a nursing facility or a long-stay hospital for at least 60 consecutive days. An individual may move between qualified settings as long as there is no discharge to the community between these facility settings. Again, we can count those Medicare rehabilitation days, which are basically the individuals that are on skilled nursing or physical or occupational or speech therapy, as well as we're able to count days in the acute care hospital that may be included in that 60-day count, as long as the individual was in a qualified facility before and after the admissions and the transition to the community from the MFP demo qualified facility. Next, please. An example of counting days here, for example, if an individual is admitted from the community to an acute hospital for 14 days and then transferred to a nursing facility for 40 days, how many days are counted towards the 60 days? Well, the correct answer is 40 days and not 54, because of the fact that we're able to count days towards that 60-day count. Another example here is that if an individual is admitted to a nursing facility for 10 days and then an acute hospital for 30 days and then returns to a different nursing facility for 5 days with no discharge between those types of transitions, how many days are counted towards the 60 days? Well, the correct answer would be 45 days because of the fact there has been no discharge to the community. We're able to count those days that person goes from the nursing facility to the hospital and back to a nursing home. So anytime we need help counting the days, you can always look for us as well to assist you in that process. Next, please. Some of the qualified facilities here on this slide are facilities that are licensed by the Department of Public Health, or DPH. These are Medicaid certified nursing facilities. They are chronic disease and rehabilitation hospitals. They are DPH hospitals, intermediate care facilities for individuals with intellectual disabilities, and psychiatric hospitals, including both public and private, as also referred to as institutions for mental disease, or IMDs, with some exclusions, which is set forth by Mass Health. Next, please. This next slide just represents a sort of a workflow process for the demonstration, where we identify the different types of qualified facilities on the left side of the slide. In the same token, the individual's working with someone like a service coordinator or a case manager to develop a transition plan to provide, to see what types of services and supports the individual could be eligible for, at which they transition out to a qualified residence, which is indicated as, the individual's own home or a family home owned by the individual's family. The individual could be leasing an apartment in the community, or maybe a community residential setting with a max of 4 individuals, or there are some assisted living residences that meet the criteria of the demonstration. And ultimately, the individual has to be receiving some type of service to remain their tenancy in the community. And some of the services that we identify here would be one of the HCBS waivers, like the acquired brain injury waiver, or the moving forward plan waiver, or maybe the frailty waiver, or maybe one of the adult ID waivers. They could also be enrolled in OneCare, SCO, or PACE, or be eligible for one of the Mass Health state plan services like the adult foster care program, or maybe the personal care attendant program as well. Next, please. Some qualified community residents, as I mentioned earlier, would be either the home owned by the individual or leased by the individual or a family member, where there's no maximum number of individuals per se related to the family that could be living there. The individual could have an apartment with an individual lease, or it could be a community-based residential setting, which no more than 4 unrelated individuals reside. And there are some specific requirements, such as these tenants must have a lease or lockable entrance and egress. They must have control over their sleeping, bathing, and cooking space. And also, they could be transitioning into an adult foster care setting, or the possibility of going to a shared living caregiver's home. Next, please. Some specific requirements are around assisted living residences. As I mentioned, assisted living residences may not be located on a campus that include a medical facility, such as a nursing facility or a hospital. Apartments must have a separate living and sleeping and bathing and cooking areas. Obviously, it's based on the participant's needs within their agreement. Units with only a microwave and no cooktop are acceptable, for such a site. Units must also have lockable access and egress. The LAR cannot require the service be provided as a condition of tenancy. They must not require notification of absences from this resident. Also, leases may not reserve the right to assign or change apartments. So again, there are some specific qualifications for assisted living residences, as noted. Next, please. What constitutes a non-qualified residence? Well, that would be a group home with 5 or more residents. An assisted living, which requires residents to share an apartment. An assisted living housed in a wing of a nursing facility or on a medical campus. Apartment shared by 5 unrelated roommates. A rest home, as well as a homeless shelter. These are all non-qualified residences. Next, please. And so we just wanted to throw on this slide here a distinction between what's qualified and what's non-qualified. And again, just some keynotes around group home settings where group home with 4 or less residents that is a qualified residence, versus a group home with 5 or more is not considered a qualified residence. We had mentioned the home owned by the individual or family member. We also talked about the assisted living where the resident has its own apartment with an individual lease and locking entrance, etc. And again, they could be entering an AFC or a shared living caregiver's home. And these again are qualified residences, where I mentioned earlier that rest homes are considered non-qualified, or an apartment shared by 5 unrelated roommates, etc., as well as an assisted living housed in a wing of a nursing facility or medical campus. These are all considered non-qualified residences. Next, please. So at this point, I'm going to turn this over to Jennifer Reed, who's going to continue this with the slide presentation around the MFE demo services. Jen?
Okay, well, thank you, John, for providing that overview of the demonstration and the grant and the benefit to the state, some of the qualifications. One of the exciting parts of the grant is the ability to provide these additional services, like John mentioned, that someone would not have access in a different delivery system. And here, through the demo, individuals can receive transitional service, assistance, assistive technology, community engagement, navigation, and case management. And I'll define those in the next slides. Next slide. So transitional assistance, we know that there are certain waivers that transitional assistance is a service that someone has access to. What's exciting about the demo is that we can provide and pay for additional transitional assistance services that someone would not be able to access. One of the big things is first month's rent. This is something new that CMS is allowing states to fund and provide. You have security deposits, utility, pest eradication, one-time cleaning. Those are also available through TA under the waiver. One of the key elements that we find is very appeasing to these individuals is the size of a TV. So we are able to kind of increase the size of a TV to 43 inches. And sometimes that's a huge benefit for moving into the community. Furniture, window coverings, home modifications. And then another piece is the washer and dryer. So again, that is something that is definitely a positive for people moving out on their own. Transitional assistance is really looked at as those non-recurring setup expenses, which is listed below. And that's how it is interpreted, that someone would need in order to move to a setting. This is not all inclusive, right? Because we know there could be other things that people need in order to get set up. And those are things that we just discuss internally. One of the pieces, even though people have access to these services, some of these don't apply to residential settings, such as first month's rent. But all of these other type of expenses that someone would need, TA can provide and fund. The other benefit of this is for individuals that are not on a waiver, and maybe they're receiving state plan services and they wouldn't have access to any of these. They can receive this full list that's comparable to someone on the waiver. So that's another exciting piece, is when we're looking at a broader population of people in nursing homes to be able to provide these type of services. Next slide. The other piece is assistive technology, and we really have seen the benefit of assisted technology, especially with COVID. This really is defined as devices, controls, or appliances that enable individuals to increase their ability to perform activities of daily living, the ability to communicate with their environment, and it's really helped promoting that community integration. These are the different components of assistive technology. Again, some of these may be covered in other delivery systems, but for the demo, it's all inclusive of these services. So evaluations is huge. Fitting, adapting, any type of the assistive technology, the replacement, because we know sometimes that's a barrier to get something fixed. There's training And then the big one is the cell phones, the tablets, computers. And again, that was a really big one over COVID and telehealth, that we really saw individuals would benefit from using this type of technology. Next slide. So those are the two that individuals could potentially receive some of those services under a waiver. This here is a brand new service that the state had really thought about through the demo to say, what is something else we can provide and offer to individuals to really incentivize moving into the community or working with an individual to become familiar with their environment. And that really starts up front, right? When you meet an individual and you start talking about where they would want to move into, this is really what we like to think of as a bridge, right? This is someone that comes out maybe, early on in their stay. They really talk about community living. They're able to provide transportation services, but it's really provided to promote and to integrate an individual to a community of their choice or they want to explore. This here, we kind of have it separated by community engagement navigation to transitional assistance, because there is some similarities. But the community engagement service, as the first one here, can be provided up to 6 months prior to transition or anticipated transition, where transitional services are really, really close to transition date. This, for individuals within DDS that may be moving to a residential home, this service could be beneficial for them to kind of see the community where the home is, to visit different programs in their community. So this is something one of the CEN providers can work with that individual. Again, the primary focus is the whole community exploration, having that individual really become comfortable and knowledgeable about their community and excited about it. And transitional assistance is really that immediate need. They're moving. What do they need in order to get set up? What are some of those barriers? Again, they can assist, identify different community settings, right? And that's broad. Maybe it's a church group, or maybe it's a different type of support group in the area, or like we talked about, the day program. The transitional assistance is really focused on housing and what is needed to get into a new home. So this is where a transitional assistance provider could work with an individual in identifying housing opportunities in the community. Maybe someone is moving and wanting to live in an apartment on their own, but they can't afford it. So as John mentioned, there could be vouchers available to assist that individual in moving out in the community. But that transitional assistance is really focused on that piece, the actual individual site. Again, community engagement navigators can actually accompany, so they can travel with the individual to kind of work and acclimate them to a community. Where the transition service, again, is maybe they want to look at housing options in whatever kind of setting that looks like, but they can take the individual out and look at them. The CEN, which is also very exciting, is it can be provided pre and post. And post means we want to make sure that people are settling in their community. Maybe they've moved in and they've heard about different groups, or maybe there's other integration opportunities that this provider could work with the individual. The new service, we're looking at approximately 10 hours a month per individual, but as we know, everything could change. And so there are minimal exceptions depending on circumstances, whether we may increase hours, but right now 10 is the max, right? But if you're seeing a greater need, then you would have a conversation within DDS and then with the project office. And again, TA is focused on transition services and supports to kind of really move them out into the community of their choice. Next one. And then case management. So this is one of the most important elements of the demonstration is to really have that one person who's coordinating everything, who's that point person that if something is going on with one of their services, or maybe they're interested in another service, that there's one point person. They're not having to go to different people, different professions to try to figure and navigate, that there is that case manager, service coordinator, right? I want to make sure I'm describing the position, but case manager, service coordinator duties are the same. That here they're really assisting and working with the individual pre and post, right? Because we're not just going to put them out in the community and do some periodic check-ins. They are the ones that really start those conversations about what is available in the community, what kind of supports can you receive, and what does the demo offer? I get excited about the demo because of the enrichment of the services. And at the end of the grant, if we can really show the benefit of it, who knows if we can recommend it as a sustainable service down the road. But this is the exciting piece of the demo in providing these wraparound benefits. They facilitate the person-centered planning process, which I know you are all familiar with. They identify the housing, authorizing services, really ensures a safe transition. They conduct a risk assessment as part of the person-centered planning. And this is really to look at those potential risks when an individual is in the community, where if something happens, that whatever it is, Tim will get into further guidance, that would really put the individual at risk and would lead them back into the institution. So we're really looking at those higher level risks when someone is living in the community. And you identify a risk, you need to have a plan. We need to work with the individual in identifying backup, whether it's a family, whether it's an agency, whether it's a 24-hour hotline. But we want to make sure individual knows and is educated and informed, what to do in certain circumstances that really put an individual at risk. And then the case manager monitors it, right? Because we know needs change, services change. So we want to make sure that it's always meeting the needs. We never want to leave an individual in the community not knowing what to do if a certain service or a support, isn't available, right? That's the focus, keeping people out in the community. Next slide. All right, Tim, I'm going to leave the next couple of slides to you.
Sounds good. Thank you, Jen. So
Yep.
Good afternoon, everyone. So these next several slides, I'll talk about what it is as DDS employees, particularly service coordinators on the IDD side of DDS and on the ABI-MFP side, what it is that we are supposed to be doing to support those individuals that we support who are interested in enrolling in the MFP demo. There was a question in the chat about will the PowerPoint presentation be shared, and it will after the presentation. And I'll be going through a handful of forms that we will be asking service coordinators to review, sign, and date. We will certainly send out those forms after the presentation with the PowerPoint slides. And in the Q&A, if you have a particular question about any of the forms, I'm happy to answer them. So the first step, if a DDS service coordinator, again, whether IDD or ABI-MFP waiver, has an individual on their caseload in a qualified setting, as described previously by John, who's interested in or could benefit from the MFP demo, the service coordinator needs to do the following. They need to review the MFP demo brochure and fact sheet with the individual and or their legal representative. And the links to those documents will be provided as well. If interested in participating, if the individual is interested, then the service coordinator will need to obtain a signed MFP demo informed consent form and complete the MFP demo referral form. Again, those are forms that we'll make available either to the links where you can get them, or we'll actually share the forms afterwards. So once the signed MFP demo informed consent form and referral form is completed, the service coordinator will email those forms to your regional ABI MFP program coordinator and the ABI MFP director. And you'll want to save a copy of those forms in the individual's file. So if you are working on the part of DDS that supports folks with IDD and you don't really know who your regional ABI MFP program coordinator is or the ABI MFP director, you'll want to certainly know who those contacts are, as they will be the people that you want to send this information to. The ABI MFP program coordinator or an ABI MFP director will enter the information into the information system. It's called MFPIS. And then they'll let you, the service coordinator, know if there's any additional information that's needed. So this side really just kind of talks about, like, if you have someone in your caseload who is interested or may be interested, this is the initial step in the process to get it started. Next slide, please. So this slide actually probably should have been in a little different order. So I'm just going to say that if you can step back from what we just talked about, this is once one of the people on your caseload is actually enrolled in the MFP demo. This is really your functions as a service coordinator as far as when you need to notify the ABI MFP program coordinator or ABI MFP director of any changes. And just to spell it out really clearly, the reason why they're the people that are really kind of coordinating the information is that we really wanted to keep access to the MFPIS system somewhat centralized, given that we don't expect there to be a huge volume for any one DDS service coordinator on the ID side of the operation. We just felt it made sense to, when you do have someone, to forward the information to the ABI MFP coordinator and director. So if the individual who is on your caseload and they're in the MFP demo, if they were to pass away, then you would want to notify the ABI team of the date of death. If they were to withdraw from the MFP demo, then you need to get them or their guardian to complete the MFP demo withdrawal form. You'd want to save a copy in the individual's file, but again, you'd want to notify the ABI MFP program coordinator and director if that happened. If the individual moved out of state, and you want to notify where and when the individual moved so that they could enter that information into the MFPIS. Transitions to an unqualified resident. So if they switch to, if they move from a small group home to a larger group home that no longer qualifies for the demo, or some other type of unqualified residence, such as some type of long-term facility, once they're already in the demo, then you need to notify the ABI MFP program coordinator about that. And then they become ineligible because either the last day in the facility is not paid by Mass Health, or they're not on Mass Health Standard or Common Health and in the community. And this would be confirmed by the Mass Health eligibility team. So again, those are, once you have someone on your caseload who's actually in the demo, if any of these things happened, then you would want to notify the ABI MFP program coordinator and the director so that they could update the system for this person. Next slide, please. Okay, So now we're back to, if you remember 2 slides ago, we talked a little bit about if you had someone who was interested early on in actually enrolling in the demo. So this is going to talk about if you have someone, if you're a service coordinator and you have someone with intellectual or developmental disability, and they're interested in enrolling, these are the steps you would take. So as was described earlier in the presentation, a risk assessment and an emergency backup plan needs to be reviewed and or completed, signed and dated before the person discharges from the facility, to allow them to be officially enrolled into the demo. So what we're trying to do here is to really kind of take advantage of any documentation that meets these requirements that already exists to minimize the additional work needed on behalf of the service coordinator. So if you are a service coordinator, supports someone with an ID or DD, developmental disability, so the risk assessment requirement. So there are 2 things that could be done here to meet this requirement. You would review, sign, and date a safety assessment if one already exists for the individual as a supporting document to the individual support plan or ISP. So again, if one exists, you just review it, you date and sign it, and then you've met that requirement. If one doesn't exist, then we created a new template called the DDS ID-DD risk assessment template. It's a brief template, and we would ask you to complete it to the best of your ability, sign and date it, keep it in the file. And then at the bottom of the slide, we'll talk about next steps for that. So that's the risk assessment requirement. For the emergency backup plan requirement, to meet this requirement, we would ask the service coordinator to review, sign, and date the evacuation safety plan residential document if the individual is going to be moving into 24/7 residential, so either group home or shared living. If the individual is not moving into 24/7 residential, then we would ask you to complete this DDS ID-DD 24 emergency backup plan document to the best of your ability. This is a 2 to 2.5 page document, so it's not very long. Complete it to the best of your ability, date it, and sign it. So once you've completed one of those documents for each of those requirements, risk assessment and emergency backup plan, then you should email the regional ABI-MFP program coordinator and the ABI-MFP director, and say, this is the individual and this is the date that I signed and reviewed the risk assessment, and this is the date that I reviewed and signed the emergency backup plan. You would want to keep the documents in the individual's file. You do not have to send the ABI-MFP coordinator and director the documents. You just have to let them know that you did review them and you signed them and dated them. And you have to give them the specific date that you did that. And again, the dates that you actually do this, they need to be after the individual signed the initial informed consent, and just prior to discharge. So they have to be in that window. So that's a lot of information, but I'll certainly take questions at the end if you have. But that's if you are a service coordinator who supports someone with an intellectual or developmental disability. Next slide, please. So if you are an ABI-MFP service coordinator, you basically, for the risk assessment, you would review, sign, and date the ABI-MFP waiver committee risk assessment. So this is an assessment that is really already being done by UMass as part of the initial eligibility for the ABI-MFP waiver. So you're really just reviewing this, making sure that it seems, accurate, correct. You sign it and date it. To meet the emergency backup plan requirement, you would just review, sign, and date the evacuation safety plan residential document that the residential provider or shared living provider where the individual is going to be moving to would already have created just prior to discharge. So pretty easy steps here to meet each of these requirements. Similarly, you would notify your ABI-MFP program coordinator and director the date that you reviewed and signed each of these documents, and then just keep a note and copy of the documents in the individual's file. Next slide, please. So step 4, when the individual on either the IDD or ABI-MFP caseload transitions to a qualified residence, the service coordinator needs to do the following. So this is when the person is about to be discharged from the nursing facility or other long-term facility and moving into the community. You want to obtain the MassHealth Discharge SC1 form from the facility social worker or business office. And this is a little visual of what the form looks like. You want to provide the regional ABI-MFP program coordinator and director with the discharge SC1 form and the following information so that they can enter it in the MFPIS. And that is the MassHealth support program type. For example, are they in one of our DDS adult waivers? Or are they in a different waiver? What is the MassHealth support program? The qualified residence type, if the individual is living with family members, the discharge date, and the address and phone number of the new residents. So your colleague, the program coordinator director, are entering information in MFPIS to track all the demo participants. They really need this information to enter, so that's why we're asking you to provide this to them. Next slide, please. Okay, so when the individual on the IDD or ABI-MFP caseload is admitted to a nursing facility, acute or rehab hospital, or their MFP demo participation has ended, the service coordinator needs to do the following. So you need to notify the regional program coordinator and ABI-MFP director within 5 business days of the event that the MFP demo participation has either suspended or ended and what the reason is. Again, they have to track this in the system. The date the individual left and or returned to the community setting. And this is important as it impacts the counting of the up to 365 days that the individual has eligible for MFP demo services. And then the reason for the participation in the demo ending or suspending. If the individual is admitted to a facility for 30 or more days, the reason for admission is required. Next slide, please. So this is a slide that really talks about the Meditech and HCSIS update for individuals in either IDD or ABI-MFP caseloads and the MFP demo. So the 3 activity codes or service codes below have been added to Meditech and HCSIS to reflect the MFP demo services. So DDS service coordinators in both programs should enroll individuals on their caseloads into these demo services. Enrollments can only be made as of last July for activity code 2232. We still need from UMass provider operations, they need to finalize and share the provider information for the other 2 activity codes. John, Jen, and Eileen have been working closely with UMass provider operations to really recruit providers to meet it to support these service codes, and they've been making great progress with that. So those that information will be provided to our Meditech team shortly. And once those are in there, then you can also enroll anyone in the demo into those additional activity codes. The MFP demo services should be listed as non-waiver services on page 2 of the plan of care in HCSIS. And I anticipate that those additional, the 2210 and the 2712 codes, we will be getting those in the Meditech shortly, because I've been in meetings recently where we have heard about some progress being made and providers being identified. So that should be updated very soon. And I think that's it for me. So I'll pass it back to Eileen or Jen.
Thanks, Tim. I'll take it from here. So we're going to talk a little bit about the referral process that Tim mentioned earlier on how an individual would sign up for the demonstration. The referral process, we have a 3-page referral form, which is on the mass.gov, the MFP demonstration website. Any point in time, an individual can sign up for the demonstration. And for those individuals that are not aware or not currently working with anybody, a case manager from another agency, this referral form can be completed at any point in time. This can be done by family members. This can be done by social workers. It can be done by the individual themselves. So anyone who's interested in transitioning to the community, and they are living in one of the qualified facilities that John had mentioned in the earlier slides, and they want to learn more about the MFP demo, they can complete this referral form. And we'll show you, I believe we have a copy of the referral form in our slides. So if the individual is already working with a case manager or service coordinator, we encourage that individual to contact that person directly to learn more about the demonstration. We will be providing links to our fact sheet and to the demo brochure that tells a little bit about what the demonstration is. And if the individual is interested, then they can go ahead and sign the informed consent form. So the referral form is really just informational to say, I'm interested in this, I'd like to learn some more. If the individual's not already working with a case manager, or they don't know if they are, they can complete the fillable form and they can email it to the MFP project office. And that email is here, the mfp@mass.gov. So we take a look at all those referral forms and we figure out next steps, and we will forward it along to the agency that's most appropriate to have somebody go out and explain more about the demonstration. So that's exactly what we do. So once we receive it, we forward it for further outreach and for follow-up. Next. So as I mentioned, referrals can come to the MFP demonstration project office from a variety of individuals on how they learn about the MFP demonstration. This can be staff at qualified facilities, as I had mentioned, social worker. This could be an admission or discharge planners. This can be individuals who are working at state agencies, individuals who are working in the Aging and Disability Resource Consortium Network, individuals who are working at aging service access points, staff. We know we are currently working with Elder Affairs on the community, the individuals in the community transition liaison program. There are a lot of individuals who are out in these facilities on a regular basis, and they're helping these individuals overcome barriers to getting back into the community. So we are receiving referrals from a lot of the CTLs. Other ASAP staff could include options counselors, nurses, information and referral staff, and independent living center staff. Also options counselors, transition staff, housing coordinators, information and referral staff. So there are a lot of different ways that individuals can find out about the program and complete that referral form and send it to the project office. Next. So the Community Transition Liaison Program is an expansion of the existing comprehensive support services model. That model was created in 2005 to support any resident in a facility age 22 or older by assisting the resident, family, and nursing facility to overcome barriers to discharge. So the CTLP staff include community transition liaison and a case assistant. So there are 2 individuals. They are assigned to nursing facilities throughout the Commonwealth of Mass, and they are visiting these facilities every week. So they act as a point of contact for residents relating to transitions to communities. They visit with them to increase their awareness, to talk about transition as an option. They have actually a very special tool that was developed to help them figure out what is the best pathway for these individuals, how they can help them get started, maybe apply for programs, enroll in different options that might help them get home. They conduct assessments to determine the potential program. They may begin gathering documentation to help if they're, for example, applying for housing voucher, or if they don't have their Social Security card, they might help facilitate some of that process. Complete referrals to other programs, working with other professionals at the nursing facility, and coordinating with other state programs and teams. So we're seeing a lot of CTL involvement with the MFP demonstration, and we're working on a regular basis to ensure that we're all sharing information and communicating across the agencies. Next. So MFP participation is voluntary. When an individual talks to and somebody about when a case manager or service coordinator is talking to individuals about possibly enrolling in the MFP demonstration, this is something that's voluntary. They don't need to do this. There are additional services available to them, so we certainly encourage them to take advantage of that option. But as I had said earlier, they can sign up at any point in time. So case management and service coordination services, as Jennifer had mentioned, those services are provided by different agencies depending on the program that the individual is enrolled in. So for individuals who are enrolled in the Frail Elder Waiver or State Home Care, the ASAP case managers will be identified in MFPIS, and they will provide those case management services. For individuals on the ABI and MFP residential waivers, ID waivers, or DDS funded services, a DDS service coordinator would be providing case management. And for those who are on the ABI MFP community waivers, state plan, and all others, MRC will be the case management, will provide case management for those individuals. Next. So this here is a copy of the MFP demo informed consent form. This is a 2-page form. This is the form that a service coordinator would have the individual or their legal representative complete and sign in order to be enrolled in the MFP demo. We sometimes receive these forms from nursing facilities, social workers, or outreach staff. We really want this only to be completed by the case manager or service coordinator that is working with that individual. So this informed consent form, really, they provide their first and last name, their Mass Health ID number. Sometimes we know individuals, they don't have a Mass Health ID number because maybe they're not Mass Health eligible yet. They could certainly put in their date of birth, or they could put in the last 4 digits of their social. This document is something that is kept on file. It is not something that needs to be sent to the project office. But the general information, this tells a little information. There's an opening paragraph about what the MFP demonstration is, the types of services that are available, that we will keep their information confidential, that they can withdraw from the MFP demo at any point in time. We do actually have a separate withdrawal form that we can provide to you. If they have complaints or concerns, that they understand that they should connect with their service coordinator, and then consenting to participate. And that's it. It's a 2-page form, and that is kept on file. Next. So the MFP demonstration, individuals sign up and they receive MFP demonstration services for 365 days. And that starts the day they transition out of the qualified setting. The reason it's important, as Tim had mentioned earlier, for a service coordinator to notify the ABI MFP program coordinator or the ABI MFP director when an individual is admitted to a facility. So let's say, for example, the individual has transitioned. We've shown some transition dates here. So let's say, for example, they transitioned on January 1st. And during that 365 days that they're out in the community, they don't end up back in a hospital, they don't end up back in a nursing facility. So their last day receiving MFP demonstration services is January 1st of 2024. If, however, an individual ends up back in the hospital or in a nursing facility, we want to pause their 365 days. So it's important that the ABI and MFP project coordinator or that ABI MFP director be made aware when an individual goes back and is admitted to a facility or admitted to the hospital, because we need to extend their end date in MMIS. So if the transition date is 1/1 and they end up inpatient for 15 days, their new end date is now January 16th, 2024. And so we keep track of all of those start and end dates. Those are all captured in MFPIS. And their end date automatically shifts because of those readmissions. So that's a very important piece that we wanted to emphasize today, is keeping track of that. Once an individual reaches their 365 days, the demonstration ends, and whatever other support system they have in place, such as a waiver, that will continue, assuming that they continue to meet the eligibility requirements. So the demo is for a period, just a period of time of 365 days only. Next. So as we mentioned, there we have a designated system that tracks all of these individuals that have signed up for the demonstration, and individuals who are given permission to access the system have to identify what their role is, and they have access to view, enter, and submit certain data. They also have access to certain reports, but this is a live system, so anytime that anything gets entered, it's immediate. So this system, the individuals the ABI and MFP staff who are responsible for entering this information, it's important that they be provided with updates regarding these individuals as soon as possible, so that that information can be entered in the system. Next. So we wanted to talk to you a little bit today about individuals and what the MFP demo program, if individuals sign up for the MFP demo, what else they can be enrolled in. There are a lot of different Mass Health programs available, different waivers that are available, managed care. And so we wanted to take a minute to go over what kind of services and programs that the demo can be combined with. So the first one is that an individual can be enrolled in an ACO, an MCO, a OneCare plan, a SCO plan, or the PACE program, and also be enrolled in the demo. They can also receive state plan long-term services and supports, and they can also be enrolled in a home and community-based services waiver. One thing we wanted to mention is there is a difference between the demonstration and the waivers as far as the facility stay days. So the ABI and MFP waivers require a 90-day facility stay, and the MFP demonstration only requires a 60-day stay. So if an individual has met their 60 days, if they want to continue and applying for the ABI and MFP waivers, they need to be there 90 days before they transition. So we just wanted to make sure that there is that difference. The 90-day stay is still a requirement for the ABI and MFP waivers. So we provided a small table down here at the bottom to indicate the program type and where the demo can be added. So you'll see in all of these, it's a yes. We did want to clarify that individuals can only be in one adult waiver at a time, but they can have the demo and the waiver at the same time. They can, you can be on an ACO and MCO and on a waiver. The only time that an individual can be on a SCO and a waiver is with the frail elder waiver. But we wanted to provide this chart to let you, so that it's an easy to understand when you can combine the demo with a waiver and these program types. Next. So this visual is to just give you an idea that the money follows the person demonstration, similar to our last slide, can be combined with all these other programs. So the demonstration can be added to for the set of services for individuals that are already enrolled in the Moving Forward Plan waivers, for the frail elder waiver and state home care for elders, for DDS services, Mass Health long-term services and supports, the ACO and MCO, those managed care programs, the senior care options, OneCare and PACE, and the acquired brain injury waiver. So this is a fantastic opportunity where individuals can access additional services through the MFP demonstration in addition to their primary support type. Next. So the MFP demonstration would not be possible without the help and assistance of all of these agencies and partnerships. We have been working since we received approval from CMS with all of these different groups to help relaunch this program, to get training out, and we wanted to acknowledge how important and how much we appreciate the partnerships with each of these agencies. So we've worked with Mass Rehab Commission, the Department of Developmental Services, EOEA, the Executive Office of Elder Affairs, the Department of Mental Health, Executive Office of Housing and Livable Communities. We are working with them. They have provided us, we have housing vouchers that are available for individuals who are enrolled in the demonstration. the Quincy Mass Health Eligibility Team, which helps us confirm individuals' eligibility for Mass Health, not only while they're in the facility, but how to get them to Mass Health Standard or Mass Health Common Health to be eligible for the demonstration once they transition. 4Health Consulting at UMass Chan Medical School that helps us certify these providers that we have for the CEN and the AT services. And of course, our community service networks of the Aging and Disability Resource Consortia, independent living centers, and our aging service access points. So we wanted to acknowledge all of the partnerships to help making this the MFP demo successful. Next. And this is our email address where you can reach us, our phone number, and then this is the website address. So the website, this provides information on we have the referral form there, we have our brochure, we have the fact sheet, and our contact information. And I think that concludes our presentation for today. So I think we're going to take questions and go through the chat.